Ozempic is an injectable medication. It's a once-a-week injectable medication, and it's replicating a natural hormone that's in our bodies. The hormone is called GLP-1, which stands for glucagon-like peptide number 1. This natural hormone in our bodies is actually part of a very complex appetite regulation system. And so GLP-1, when given as a medication, lasts longer in dampening down our appetite and our hunger and our desire for food. And that when we do eat, we feel full with less food, and then we feel full for longer. It is a medication that has had significant effects from a weight control point of view. That's why we're hearing so much about the clamour for this medication.
Ozempic isn't just making waves in the medical world, it's also dominating social media feeds everywhere.
The celebrity has improved the dissemination or the talking about this medication, and I think that is a disservice for people who actually have a chronic medical condition called obesity. And that's very different from someone who's wanting to lose weight from a body image point of view, and I think those two things need to be completely separated. And I do think that some of the celebrity use of this medication has contributed to this imbalance of supply and demand.
Given the high demand, there's a growing consensus that priority should be given to those with type 2 diabetes.
That's what our regulators are asking of both prescribers and pharmacists. In my mind, it wouldn't be black and white as to only people with type 2 diabetes having access. It needs to be controlled for the people who need it most, being able to get supply whilst there are issues with demand. If you're on a PBS script, I do believe that will put you at the top of the list of people asking for this medication. This is a newish medication. We don't know what we don't know. We still have what we call post-marketing surveillance to see if we're picking up side effects or risks or concerns that were not seen in the clinical trials done by the drug company. And this is why it's important that if a patient has heard about Ozempic and wanting to know more, that they go and see their trusted medical prescriber to talk about whether this medication is suitable and the pros and cons, both short-term and long-term. Start off with the lower dose, make sure that you tolerate it. I really hope that we don't use this medication for the perceived quick fix. I hope that this medication is not used in regards to body image concerns, which at their extreme can actually be a mental health condition. I'm hoping that we use this as an add-on tool for healthy habit gains, lifestyle changes, and it's actually treating clinical obesity as a chronic complex medical condition or health conditions associated with obesity. If it's really about trying to look good at a reunion or get into a certain size for a particular event, I understand the social pressures that the person would have, but there are significant side effects, particularly in changing body composition with rapid weight loss, which may ultimately be doing their metabolic risk worse than if they stayed healthy at a larger size.